try that.
I'd like to call to order this meeting of the Board of Commissioners. The date is January 26th. Our invocation today is by Commissioner Holtfloor and followed by the Pledge of Allegiance. Please rise. Mr. Holtfloor, are you on? I think he's muted.
He dropped out.
Or we lost him. Here he comes.
There he is.
Jim, you're muted. Jim, you're muted. Mr. Holtfloor?
Pretty long prayer, ain't Greg?
Unless he meant a silent prayer.
Would someone else offer the prayer? Would you offer the prayer?
I will.
Okay.
Will you pray with me? Heavenly Father, Lord, we thank you for this day, Lord, that we can come together as the Board of Commissioners and make decisions for the people of Ottawa County. Lord, we ask a blessing upon this meeting. Be with us throughout the whole meeting. Lord, always protect those who are serving us, whether in the United States or overseas, and a special protection for the men and women of law enforcement for this country and for our county. All these things we pray, Lord, in your name. Amen.
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 And who is starting us off in prayer? You are? Okay.
I pledge allegiance to the flag
Of the United States of America. And
And
to
to the republic for which it stands,
one nation, under God, indivisible, with liberty and justice for all.
Sorry, Sherry, I should have asked you before.
Oh, that's okay.
I assumed that it was either going to be Justin or yourself, but, so Justin, are you going
Yes,
to
sir.
call the roll?
Yes, sir. Mr. Garcia,
I'm here.
Mr. Bauman,
Here.
Mr. Zylstra.
Here.
Mr. Dannenberg.
Here.
Mr. Meppelink,
here,
Mr. Terpstra,
Here.
Mr. Holtfloor,
present,
Mr. DeYoung,
Here.
Mr. Kyers,
Here.
Mr. Bergman,
Here.
and Mr. Fensky.
Here.
Mr. Chair, we have a quorum.
Next thing on the agenda is presentation of petitions and communications.
I have none.
Okay, thank you. And then we have an update from Lisa. Is she on? Yes, she is. Yes. Hi, Lisa.
Hello, everybody. Good afternoon. Everybody slide in today. So I want to give you a little update, and then Dr. Heidel is going to step on and talk a little bit about the variants that you've probably been hearing about in the news. So as of Monday, we've had 20,877 cases of COVID in Ottawa County, 317 deaths, preliminary case fatality of about 1.5% in Ottawa County, 2.6% in Michigan, and 1.7% fatality rate in the US. We've had 612 total hospitalizations with a hospitalization rate of 2.9%. Our case counts have been in a significant decline over the past 2 weeks, which is really, really good news. We were struggling there through October and November, and we're finally seeing things down by roughly 35% since the beginning of 2021. Hospitalizations and deaths have also been decreasing, follows to the lowest level in 3 months. So again, really great news. Overall, last week, we've been averaging about 77 cases reported each day. much lower than late 2020 when we were routinely seeing over 300 cases a day. So our weekly testing positivity rate fell to 8.5%, which is also the lowest that we've seen in the past 3 months. And that has continued to decline in recent weeks. We hope that that trend will continue. And if everything that we've been seeing over the past 2 weeks is any indication, we likely will see that reduce even further. The time it's taking to get a COVID test result is in 1 to 2 days. And you probably recall us talking in the past about during that peak, it was taking 4 to 5 days, sometimes depending on where you'd go for a test, it could take even 7 days. So that's really good news. And although we've seen some cases among school-aged children and school staff, the number remains pretty stable in that environment as well. As far as vaccination goes, I want to talk a little bit about what's going on in that area. We continue to get what I consider to be low numbers of vaccine. I've mentioned to you in the past that we are seeing 975 doses a week. This week, we did get 975 doses of new vaccine, but we also got 975 doses to do second vaccines for folks. Last week, I mentioned to some of you that we got 1,600 doses of Moderna, which allowed us to provide double the vaccinations that we've been able to in the past. So we were pretty excited about that. We've generally gotten Pfizer every week. That was our first allocation of Moderna. Thus far, in collaboration with our hospital systems, we've come very, very close to completing phase 1A of the vaccine prioritization schedule. Just in case, just to remind you, phase 1A are all of the healthcare workers who may be dealing face-to-face with individuals or infectious materials, serving in a healthcare setting in most cases. It also includes those individuals living in long-term care facilities. Walgreens and CVS pharmacies have been vaccinating residents in long-term care facilities. It's not a process that can happen really, really quickly, but we are seeing some progress. Unfortunately, I don't have data specific to long-term cares, adult foster care facilities, and skilled nursing facilities in Ottawa, but I do have some state data. So since they began, the state, in the state, all skilled nursing facilities that have enrolled have completed at least one clinic, which is good news. For assisted living and adult foster cares, enrolled almost 2,040 are scheduled for their first dose, and 515 have actually completed their first clinic. So I think there's about 4,500 in those two categories of skilled nursing and adult foster. So we've got a ways to go, but we are making progress, and we're getting really good feedback from those folks that are actually living in those congregate care settings. They're so pleased to get their vaccine, and we're very thankful that they're getting there. As you know, we have expanded access to 1B. We have prioritized within 1B older adults age 65 and older, which I've talked about before. This is a very strategic approach. It's in some cases a little different than what you're seeing in other counties, but the rationale behind this decision is based on all the data that's suggesting a disproportionately more severe outcome of related to COVID-19 in this age population in comparison to other populations. And so we feel good about this. There are some other opportunities for some of the critical and essential infrastructure workers to get vaccine outside of the county. And so we've been directing them to Kent and Muskegon until we get to the point where we have enough vaccine to start expanding our clinics to critical infrastructure workers. In addition to some of the partnerships that I've already mentioned, we continue to work closely with our strong network of local partners, including those that are assisting us reach our most vulnerable populations. As I've mentioned, one, we want to ensure equitable access to COVID-19 vaccine, and two, we want to reduce the disproportionate impact COVID has had on our older adults and minority populations. We've been working with a network of local organizations including organizations that serve our senior population and minority populations, and churches who actually have touch points with our targeted populations. And we've been doing kind of a pull in. We'll have our organizations calling out to members of their church or members of their, like, for example, Evergreen Commons or some of our other senior living facilities, and invite them to participate in the vaccine process. And they will actually go in and schedule an appointment for them. It's been working really well. We had a clinic that targeted some of our minority populations. Oh gosh, it was last Friday. And we had a few bloopers, but then we brought our team back together and we made some tweaks, and it just went, the next clinic that we had went so well. And we were able to get a lot of compliments and a lot of very, very happy customers that were so thankful for the outreach and the assistance that they received in signing up. And we're also doing a clinic this week in conjunction with Highland Hospital and Evergreen Commons, where they're doing the same kind of thing, or pulling people in and setting up and scheduling appointments for them to ensure that some of the people that have maybe don't have access to technology or just are not as familiar with how to use it as some individuals. And so that's been working really, really well. We have a few other things going on this week. We're working with Spectrum Zealand and Metro Health. They're going to be providing clinics to some of the individuals living in independent communities, independent living communities. Those folks are not part of the contract with the pharmacies to do the long-term care facilities. It's like a different like category of folks, and so that falls to us. And we're working real closely with our hospital partners in Highland and North Ottawa are also helping with that population. There have also been a lot of partnerships going on regionally, including all the West Michigan health departments and hospitals that have been working together to ensure the dissemination of timely and accurate vaccine information. Some of the accomplishments that have taken place in this regional group include joint communications. We've developed the shared website, which I've been promoting for the last, couple months now. We've been kind of working out some of the bugs collaboratively and identifying best practices and how to reach our most vulnerable populations, as I mentioned, how to deal with things like transportation, how to quickly set up and put together mass vaccination clinics. And we've been doing a lot of talking about drive-through clinics and what the best approach to that might be. We've been working on shared responsibility between hospitals, competitive hospitals and health departments for vaccinating target populations. You may have heard about a new regional vaccine clinic that's going to be held at DeVos Center in Grand Rapids. Again, that is open to all individuals in the region. It's not just intended for Kent County. And so we have been referring some people to that clinic. The vaccine is actually coming from all the participating partners in Kent County at this point, which also our healthcare providers in Kent also serve all residents in West Michigan. So it's a really nice network. The hope is to set up other regional vaccine clinics. It's likely that we will have one or more here in Ottawa County as well, but we're starting with the DeVos Center. The number of vaccines disseminated by Ottawa County Department of Public Health, this is not the hospitals, this is just our department, so far is 6,683 since the start of our vaccine clinics on December 18th. We're very, very excited about this. This week, we will vaccinate we'll provide 3,000 vaccines, and that again consists of new people as well as second doses for those that have already been vaccinated. I know that many of you have received phone calls from your constituents about just challenges with getting the vaccine and how do I sign up, and I don't have a computer, I don't have an email address. And right now the system is that you can direct them to call our department. We have a big spreadsheet of all of these individuals. We take their name, their date of birth, and their phone number. And as soon as we have appointments open, we call them and we help them to sign up. Another option for them is that they are able to call 211. 211 is, they're going to be doing some work regionally, and they're setting up a process to help people as well who don't have access to technology to get set up in a vaccine appointment, not just in Ottawa County, but throughout the region. So there's 2 different options for you. The other option for those that are a little bit more tech savvy is to go onto our website, myottawa.org, or go on to the vaccinatewestmichigan.com, and there's a button that says I want a vaccination, and you click on it and you put your information in, and we outreach using technology. And right now we're doing kind of a split when we schedule appointments. We do half from the list of calling people and half from the list of people using technology, just to make sure that we're kind of equitably distributing those. And we've also reserved some appointments for those special populations that I mentioned in our minority communities, so that those agencies that are helping to set appointments have spaces that they can plug those folks into. Again, all with the intent of ensuring equitable access to COVID vaccination for Ottawa County residents. Next week, I should mention, I think I've mentioned in the past how this vaccine allocation works. We actually order vaccine on Thursday, and then on Friday, we find out how much vaccine we're going to get in relation to what we ordered. And then on Monday or Tuesday, depending on the week, we receive the vaccine. So it's challenging for us to set up clinics in that amount of time when we don't have any idea how much vaccine we're going to get until Friday, and we have to start vaccinating on Monday or Tuesday. Evidently, the state is saying now that they're going to change that allocation process. It appears to be some assurances from the feds that we will be getting more vaccine. We didn't see that this week, but we remain hopeful. And how it will work from now on is that we won't order anymore. They are coming up with a formula. I can't tell you a whole lot about what the formula looks like, other than that it's going to be based on population and disproportionate populations, meaning, how many people do we have living in poverty? How many people do we have in minority communities, and some of those areas? So depending on those indicators, there's I can't remember what it's called, social index indicator. I can get you more information on that. But as soon as we get the formula, I will let all of you know. I really, really hope that it means that we're going to get more vaccine, given that we're the 8th largest. I think we're even close to the 7th largest county in Michigan. It should mean that we eventually will get more than 975 doses a week. So we remain hopeful. Our goals moving forward, just briefly, we are continue to plan for opening up vaccine for critical infrastructure workers. The first tier of that will be teachers and law enforcement. So we're just waiting for that additional vaccine to open up spots or appointments for those folks. Our goal eventually is to reach 10,000 vaccines a week, which we know we can do easily. We've easily at the Meyer campus been able to vaccinate 1,000 people a day, and we can increase our capacity. We're also looking at some other venues that we can use that have a little bit more space and a little bit easier access for those individuals that have some mobility issues. So we're working on that. We want to expand our system. I mentioned that we're working with all of our partners to pull in some of our older adults and some of the folks from our minority communities, and we want to expand that. We've been testing it. It's been going really well now. I think we can really increase that. We want to ensure preparedness in the event that we have another surge in cases. I'm not going to touch on them and let Dr. Heidel talk a little bit about the possibility of that happening. We think it's likely, so we have to be prepared. We want to reestablish the network that we had during the fall with our seasonal agriculture workers, because we know that in the spring we will have a lot more folks coming into our community, and we need to make sure that we're all set up to do isolation, quarantine, vaccinations, and all that for that population. And we're right now planning on continuing and expanding our hospital partnerships to support our vaccination clinics in the community. I can't remember if I mentioned, but Metro and Spectrum are going out to our independent care facilities and doing vaccinations. So It's just really, really going great, these partnerships. We also need to expand our volunteer network because we know the more people we vaccinate, the more people that we're going to need to help us in those efforts. So, and we're going to be doing some recruitment in that area. We're also planning on pushing out vaccines so that we're not always the ones that are having to be the vaccinators. We had a great system when we went through H1N1 where we literally pushed out the vaccines to others in the healthcare community to actually do the vaccines in some kind of more common venues like in doctor's offices or through hospital or clinics that are held through our healthcare system. And we think that's a really good way to do things again, to reach people in different areas of the county. And we're also, as I mentioned, going to be supporting these regional vaccine clinics. So DeVos will be supporting that, hopefully with vaccine and maybe with some volunteers, especially after we can really get into a space in Ottawa County where we feel like we're up and running and reaching a larger proportion of our population when we get more vaccine. So I can take any questions, or I can wait until after Dr. Heidel talks about the variant and maybe a little bit more about what's going on with COVID risk. Would you like to hear from?
Listen to the doctor first, okay?
Okay, sounds good. I'm going to step out then so he can take off his mask while speaking. And can I share my screen real quick? Because I want to put up a little graph for him.
Sure. Yep.
Okay. Oops,
You able to share, Lisa?
I think so. Give me a quick second here. Okay.
Just change your permission, so you should be able to.
Oh, perfect. Now, got it. Thank you, Justin.
Yeah.
Can you see a graph?
Yes.
Okay, great. I'm going to let Doc take over.
My opera glasses.
Yeah.
We need to see it a little larger.
It is kind of small there. Good afternoon, everyone. Lisa asked me just to give a quick update here on these new strains of viruses that are out there. And just let you know that the COVID-19 virus is a member of a group of viruses called the adenoviruses. And there are about at least 50 other viruses in this group. And the thing is that they mutate fairly frequently. And most of the mutations that they have are minor mutations, not of any clinical significance. But unfortunately, we've had 3 major mutations here that could affect us here in this country. First of all is the United Kingdom strain. This is also called the UK strain or the B117 strain. It's in at least 20 states here in the United States, so it's here already. There are at least 293 cases that have been identified. 72 of those are in California, so that's kind of the hot spot right now. But we have had at least 17 cases here in Michigan, unfortunately. 13 of those occurred down in Ann Arbor at the University of Michigan in their athletic program down there. So right now it's on the other side of the state, but again, just the fact that it's here is a concern to us. This was first noted, this strain was first noted in the United Kingdom in September, and already it's thought to be, it's going to be the predominant strain here in the United States by March of this year. So the thing that's really concerning about this particular strain is that it's thought to be up to perhaps 70% more transmissible or more contagious than the current strain that we have right now. And if you look at this graph over here that Lisa put up there, this is a hypothetical case here drawn up by one of the epidemiologists, but it shows 3 viruses and what can happen. The first one, that sort of that gray line toward the bottom there, is a virus that's sort of the original virus. And I should mention that along the left-hand side of that graph going vertically, those are deaths that occur per 100,000 10,000 infections. And then along the bottom would be time in days. But anyway, if you look at the gray line there, that's the original virus. If that mutates and becomes 50% more lethal, you can see that there is an increase in the number of deaths, but not that much. And again, it's a linear. But when you go to a mutation that's 50% more transmissible, you can see that this goes up exponentially, and that's what we're concerned about. So that's the one concern with this. The second concern is that originally they thought that this virus was no more lethal than the current virus that we have right now. But over the weekend, a report came out from the UK that says that it may actually be 30 to 40% more lethal than the present virus. So again, that's one study, based on one study. So things could change. But again, that is another reason why we're so concerned with this particular strain. The other thing that is the good news is that there is the vaccine that's out there is thought to be effective against this strain. So that's strain number one. The second strain is the South African strain, also called B1351. This was identified in October. Already it's in 22 countries around the world, and that includes Canada. So if it's up in Canada, again, then not very far away from us. The good news is that on this one is that it's not here yet in the United States. But just like the UK strain, it's highly contagious, much more easily transmitted than the current strain. And one of the concerns with this particular virus is that this strain has been shown in one study to reduce the effectiveness of the current vaccine by up to 50%. So again, this is just one study. And again, the virus is not here yet, but it is a concern. It seems that somehow the virus is able to bypass the antibodies, or at least some of the antibodies that are formed by the vaccine. And that raises the possibility that somebody could become infected more than one time with this virus. Pfizer has said that the vaccine is effective. It's not worried about it. But on the other hand, Moderna is looking at a possible second dose, actually, second booster dose. So actually, that would be 3 doses. So just the fact that Moderna is thinking about this does make us concerned that there may be some validity to that. Then the final strain that we're concerned about is the Brazil strain. It's also called P1. And this is one that we don't know very much about. Unfortunately, it was just identified here in a patient in Minnesota yesterday. So we know we have at least one case now in this country. And once we have it here, all you need is one case, and it certainly is not going to stop there. Again, we don't know too much about this, but we do know that it has the same characteristics as the UK and the South African strain, and that it's highly contagious, highly transmissible. And it may be that, much like the South African strain, that it may be able to bypass vaccine-produced antibodies. So as far as the potential impact of these 3 strains that we're looking at, again, we have 2 of the 3 here. So obviously, we're concerned about more cases because it's more highly contagious, more transmissible. We're looking at probably more hospitalizations, and that's going to have a greater impact on our healthcare system, impact on our inpatient beds, our ICU, our ventilators, and of course, more deaths if you have more patients, especially if that one strain is proven to be more lethal. And of course, unfortunately, if we have more cases, that can have an impact on how businesses and restaurants and sporting events, how they're dealt with. Likewise with schools, higher case counts, higher death rates could certainly result in the schools having to go to remote learning. One of the public health issues that we're concerned about is that it's thought that we need about a 70% vaccination rate for herd immunity. But now experts are saying that because this is so highly contagious, it's possible that we might have to get up to a 90% vaccination rate. And a recent survey that came out just recently shows that 20% of Americans are not planning on getting the vaccine. So it's hard to get to 90% when 20% aren't planning to get the vaccine. As far as further mitigation efforts, we're concerned about those too. You know, if this is that highly contagious, it may be things like masks that we're using now are not going to be effective. They're already saying that we may have to go to double masking. It may require N95 masks. We may have to go to stricter cleaning protocols and things like social distancing, where we're accepting 6 feet separation now may not work. We may have to go to 10 to 12 or 15 foot separation there. And of course, that's going to expand, mean that we're going to have to do expanded contact tracing when we get identified cases. We're going to have to do expanded testing, and there's going to be stricter quarantines for anybody that's identified as a contact of somebody with B17. And we're going to be having to go back to the 14-day isolation periods in cases like that where you do have exposure to a known case of B17. So these are all things we're considering and thinking about, and none of this may ever happen for all we know, but certainly the fact that it's out there, we are concerned about it. Just before I came in here, though, I did get a good piece of news that there's a woman who recovered from COVID-19. That's not too earth-shattering by itself, but turns out this lady is 110 years old. So I guess there's hope for the rest of us. So I'm going to turn it back to Lisa now, and then any other questions, be glad to answer them later.
This is a question for Dr. Heidel. Can you email us that chart? Because we couldn't see it too good out here.
Yeah, we'd be glad to do that for you. Yeah, sorry, it is a little bit small. And again, that's a hypothetical chart, but it shows what happens when you have a virus and then it mutates to a 50% lethality and then 50% greater transmissibility. So, but we will get that to you.
Thank you. Hi, Lisa, you're on.
Hi, any questions?
Oh.
Lisa, I have a quick question for Dr. Not Fauci, but Dr. Heidel there. Are the symptoms are the symptoms the same for the strands as they are for the COVID-19?
Sorry, couldn't hear you.
I said, are the symptoms the same for the new strands as they are for COVID-19?
Right. Yep. Again, these are relatively new, but the information that we have so far is that they're basically the same symptoms, no different.
Okay. And then I think I heard you say that it's possible that we may need a third vaccine because of those strands. Is that what I heard?
Well, the South African strain they're concerned about that the present vaccine may be able to be bypassed by the South African strain. But again, Pfizer says that their vaccine works okay. They're not worried about it. Moderna is looking at the possibility of a third vaccine, a third dose. But again, that's based on some very limited data. So it may turn out that what we're doing is fine when we get more data, but that is a real concern right now.
Okay, thank you.
Yes.
Dr. Heidel, Commissioner Baumann, quick question for you regarding testing. Are we testing for the other strains as well as COVID-19, or do you have to have COVID-19 and then they test for the other strains?
Well, that's a really good question. The way the testing works right now is that they do a certain subset of tests, a certain proportion of the tests that are out there, sort of a random screening. And they will it's a genotyping that they do, genosequencing that they do for that. The other possibility for testing would be if somebody sends in a sample, maybe say Spectrum sends in a sample, and they say, we want this tested. But normally it's just a proportion of the tests that they do. Interestingly enough, that the United States, unfortunately, ranks about 60th in the world right now for genome sequencing for these strains. Now, it could be because we do a lot more testing than other countries, but there are some countries that do much more proportionally, do a much higher genome testing than we do.
Okay, thank you.
Any other questions for the doctor? If not, we'll let Lisa come back. Thanks.
Okay.
Hi, Lisa.
Hi. Any
Well, I'm
other
going to
questions?
start it off with a couple of questions, and then
Okay.
so I first of all want to thank you for the information regarding some of our senior citizens, because I have had several phone calls from seniors that have tried to get lined up for shots and haven't had much luck. So I appreciate that. And so if you could, I'm wondering if any of that information could be public service announcements that could be put on, media of some sort that older citizens rely on, like radio stations and television, local news, and that kind of thing. That would, I think, be very helpful if you could do, if that could happen. And the other question that I have is, there are a couple of other vaccines that are coming on, AstraZeneca and Johnson & Johnson. What are you hearing about those, and are you going to be ready for those as well?
We are hearing a little bit about those. Gosh, I think the Johnson & Johnson vaccine just passed some of its first phases of rigor that needed to happen. And once it goes through that process, it moves into this phase where they establish this emergency use activation. And so we're thinking and we're hearing from our state partners that it will likely be the first part of March when we will begin seeing some of that vaccine being distributed. We're really, really excited about that. Doing a 2-dose series comes with a lot of challenges. When you think that for every 1 dose, we have to schedule another appointment, it means somebody has to come back to us, especially when we're talking about populations that have challenges with, getting places and the winter and mobility and all this stuff. So when we get to a 1-dose shot, it's going to be great. We're looking forward to that. We don't know anything about how much or how it will be distributed yet, but I imagine it'll be, based on the same kind of formula as we have right now with Moderna and Pfizer.
Okay. So anyone on Zoom have questions for Lisa?
Can I just add one thing about the other newer vaccines? It's my understanding too that they don't have the same rigid storage requirements for the deep freeze and all this stuff. So it'll be easier for us to push that vaccine out to our partners, which is going to help a lot in reaching all the people that we need to reach with vaccine.
Anyone on Zoom? Okay, anyone in the...
What is, Lisa, Phil, Kyers, what is the shelf life for most of the vaccines that come in?
Oh, it's really complicated. I'm not sure I'm going to be able to get it right off the top of my head, but once you've reconstituted a Pfizer dose, you can put it back in the freezer, but not the deep freezer or the refrigerator for a few days. And then once you take it out again, it's got hours before it needs to be used. And there's really strong limits to the Moderna too. I would be happy to get you exactly what that is. I don't want to misinform anybody, but it is rather complicated. And we do have situations where it's the end of the day and we have vaccine that's been reconstituted and we have to use it right away. We have a little call list of folks that, live 5 minutes away that we call in just because we don't want to waste a single dose. But yeah, there are some limitations.
Okay.
Thank you.
Anyone else? Hey, Joe?
Lisa, Joe Bauman. I am on the McDowell Area Transit Authority Board, and we were talking yesterday. When roughly do you think we'll be able to get the drivers vaccinated?
I would consider, I have to look at the list, but I don't know if they would be critical infrastructure probably. So I wish I had a really concise answer for you, but it is all contingent on when we get more vaccine. We're hoping maybe by mid to the latter part of February that we're going to be able to move into that phase. We just don't know, unfortunately.
Okay, thank you.
Anyone else? Thank you, Lisa.
You're very welcome. Thank you all.
Good report today. Very good.
Thank you.
All right. On our agenda is public comment. If anyone here would like to speak, they can come forward. Or anyone on Zoom. Is there anyone on Zoom that would like to speak to the commission at this time?
Not currently, Mr. Chair.
Thank you. The next thing on the agenda is approval of the agenda.
So moved.
Support.
Been moved and supported. Comments or questions? Justin, would you call the roll, please?
Yes, sir. Mr. Kyers,
Yes.
Mr. Holtfloor,
Yes.
Mr. Garcia,
Yes.
Mr. Dannenberg, Mr. Dannenberg,
Yes.
Mr. DeYoung,
Yes.
Mr. Zylstra,
Yes.
Mr. Terpstra,
Yes.
Mr. Meppelink,
Yes.
Mr. Baumann,
Yes.
Mr. Fensky,
Yes.
and Mr. Bergman. Mr. Bergman.
Yes.
Motion passes. Thanks.
Next thing is action on report, consent resolutions, Mr. Fensky.
Thank you, Mr. Chair. I would like to make the motion to approve the consent resolutions 1 through 3. Support.
Been moved and supported. Comments or questions? Clerk, would you call the roll, please?
Yes, Mr. Garcia,
Yes.
Mr. Fensky,
Yes.
Mr. Zylstra,
Yes.
Mr. Dannenberg.
Yes.
Heard you that time. Mr. Terpstra,
Yes.
Mr. Meppelink,
Yes.
Mr. Holtfloor,
Yes.
Mr. Baumann,
Yes.
Mr. Kyers,
Yes.
Mr. DeYoung,
Yes.
and Mr. Bergman. Motion passes.
Under action items from administration, Mr. Kyers.
Thank you, Mr. Chair. I'd make a declaration of local state of emergency resolution. The motion is to approve, and authorize the board chairperson and clerk register to sign the resolution to extend the state of emergency within the Ottawa County due to the COVID-19 pandemic.
Second.
Been moved and seconded. Comments or questions? First of all, I'd like to ask Al just to reinforce what this is about
Right.
for the public.
Certainly, Mr. Chair. Yes, this is not a resolution that impacts business within the county in any way. It does not impact education. It's not externally focused at all. All of those types of situations are covered by the DHHS directors, states of emergency. This is directed at county operations, and it allows the county administrator to issue administrative rules, which is an authority the county administrator had actually 3 years prior to me coming here, I think is when the board added that. So it's 20 years old. And basically the way this process works, I don't really initiate the ideas for many of these at all. It's, and we have a team that works on these. So it could be initiated by the sheriff's office. It could be initiated by the public health officer, by HR, by fiscal. John and Doug, so deputy administrator, corporation counsel, and the folks that I just mentioned typically do these as a group. And they're intended to allow us to add employees when we need to with COVID dollars. And so you'll see that one of the administrative rules that's on your reported on your agenda today, which is Administrative Rule 2027, basically adds a vaccination logistics specialist at $25 to $30 an hour. It's a part-time, non-benefited position, and it basically will help us in the vaccine distribution effort. So this one AR, normally to do something like this could take a month or more when we run it through committee and bring it to the board. This allows me to make that decision fairly immediately, again, with the input of the team. Lisa requests it, HR and facilities works with it. We make sure the money's there from one of the COVID grants and funding that we get, and then we act on this. And then I report it to you on the next agenda of the board meeting, after which it's been issued. So we've issued 27 of these since COVID started. And I really haven't heard any complaints with any specifics of any of the 27. I know that there's been some Facebook traffic about, you know, me having too much authority and all that kind of thing. But it's a 2-week leash, and it's a team that's putting these together. And it involves moving people, working people out of classification, transferring people within departments, adding staff resources as a very overtaxed health department has needed them. And that really, and then dealing with employee benefits. If people have not been able to take any vacation because of the requirements of their job, we've used ARs to extend that. We've used ARs to deal with sick time and allowing that to be used for COVID in the event that somebody's has to be quarantined because of a family member. And so it's been really all those administrative detail type things that the AR is used for that allows us to nimbly meet the requirements of a changing pandemic situation. So, and again, I look at the accountability as being 2 weeks. They're on the agenda and everybody has a chance, and the board and the public, to address the specifics of one of these. But again, it hasn't happened yet.
Okay, thank you. Comments or questions?
Yeah, Mr. Chair.
Zylstra?
Yeah, I know. I appreciate everything administration has done under the declaration these past 10 months, and especially the past summer when they were most in use. But I do think that at this point, any adjustments we need to make going forward to county policy to combat COVID can be done through the board.
Okay, looks like
We as a board also have the ability to call a special meeting in less than 24 hours. If things change drastically, or for whatever reason the board is unable to take the necessary steps, we can always reinstitute, but I will be voting no on this extension.
Okay. Anyone else?
I got one. How many other counties are under a state of emergency? And I understand from the last meeting, you said that more counties would be issuing state of emergency. So I was just wondering how many are currently, and then how many you expect to be adding state of emergency?
Commissioner, I don't have an answer to that. I really haven't looked, but I will put that out on the listserv and find out and report back. I do know that Kent County, last I knew, had a similar situation, but they weren't doing it through a state of emergency. It was a resolution that simply granted the administration that authority without calling it a state of local emergency. But I will put that out on the listserv and check and report back.
Okay. Anyone else?
Mr. Chair, Randy Meblink. Also, I have a question on the, I think here I just lost my train of thought. I was waiting. So I apologize. The state of emergency in Zoom meetings, is that what allows us to do Zoom like this, or without the state of emergency, can we not Zoom then? Is that, at one time, I think there was something involved in that. Can you clarify that?
At one time, the legislature passed a law that required you to have a state of emergency in order to have Zoom meetings. And I think that our council, Doug Van Essen, has taken a different approach to that. So even though we do have meetings that have partial participation in person and partially on Zoom, there are many other governments that are only doing on Zoom at this time. And Doug, you can probably explain that a little more thoroughly than I can.
Yeah, Commissioner, in response to your question, under the new Open Meetings Act, we do need a state of emergency in order to have partial participation by Zoom. The legislature interfered with my opinion by fixing the Open Meetings Act to offer that clarification, and it in that way may have restricted what the law used to provide. I don't anticipate that the governor will lift the state of emergency within the next 60 days, but our state of emergency is an important backup to enable what we're doing today to continue to occur. I would also note that I know our emergency management director cites these declarations in his applications for grants. So it's important to our emergency manager that we have these in place. I can't be more specific than that because I don't know exactly why, but he reached out to me today, as a matter of fact, just to make sure that it would be extended today because he needs to cite that in his continuing work. So I think it does a number of things. I added in this variant, this resolution, a paragraph at the end to help you communicate to your constituents that this is internal only. Okay, so you'll now see a paragraph that expands on what Al's verbal comments have been in these meetings, but obviously a lot of our constituents aren't attending these meetings, and it clarifies that this is an internal operational thing only to help us meet the crisis. It doesn't extend or impose any restrictions whatsoever on the community. So that's now an express part of your resolution.
Thank you. Thank you.
Mr. Chair, I see the disadvantage of by not doing this, of the grant money we could lose if we're not doing fast-paced things on some of these that during COVID. So I see no reason not to do it.
Yes, and our emergency management team this morning expressed concern and also that his appreciation for the fact that we do pass this and allow this to continue. So anyone else?
Yes, Mr. Chair.
Yes.
This could be either for Al or for Doug. You mentioned that in past, I don't know, 6 months that we've had the emergency declaration in effect, that there's been administrative directives, maybe 27, that you and the committee has recommended and put together. After this emergency declaration has gone through its course and it's done, what happens to those 27 directives? How does that roll back, or does it stay in place, or is that unknown?
I'll let you know what I think, and then Doug could chime in too. Once the emergency is over, we would go back to our pre-emergency state.
No.
There may be some things that, for example, right now we have put a moratorium on any internet fees to do business for the county. Whether we'll want that to end right away or whether we'll want to phase that back in. So there may be, but each one will need to be looked at. Some will automatically go away, I think, but others we may, but then the board would need to readopt those once the AR is completed because the situation is
If we
done.
wanted those
Yes,
to
if you wanted
remain
those.
into effect and to
Yes.
continue.
Commissioner, I started out as a drafting proposition, putting end dates on Al's administrative resolutions, and then it just got too complicated. So now I tie bar the end date to the end of our declaration.
I see.
So when this declaration event, and we're doing it in 60-day increments to try to keep a tight lid on this so that we don't overextend this power. I think we're on the 5th extension now, much longer than anyone anticipated, but we're trying to do this every 60 days so that you, as part of your check and balance on the power.
Good, thank you. Yes, Jim?
Is this then 60 days we're extending this?
Yes.
Till the end of March?
Yep.
Okay,
thank you.
Anyone else?
I just wanted to say, I think it's important that you had mentioned about, sometimes there's chatter on social media and Facebook and et cetera. So I think it's important that however, and you mentioned it earlier, however we can disseminate this information and let the general public know the ins and outs and in the process, I think it certainly will help out, those that are perhaps in doubt.
Very good. And I know that Shannon has put some of this out on Facebook, but I'll definitely encourage her to keep that up and every time one of these is done, keep pushing that information out.
All right. Justin, would you call the roll, please? I was looking for Justin.
Yes, sir.
Justin, where are you?
I'm still here. Mr. Dannenberg.
Yes.
Mr. Baumann.
Yes.
Mr. Fensky.
Yes.
Mr. Meppelink.
Yes.
Mr. Terpstra.
No.
Mr. Garcia.
Yes.
Mr. DeYoung. Mr. DeYoung,
Yes.
thank you. Mr. Holtvluwer,
Yes.
Mr. Zylstra,
No.
Mr. Kyers,
Yes.
and Mr. Bergman.
Yes, 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 yes. Get it?
I think the mics take just like a second to pick up, and that's why the delay. Sorry about that.
That's
Motion passes.
All right. For planning and policy, Mr. DeYoung.
Thank you, Mr. Chairman. Regarding the 2021 Ottawa County Parks and Recreation Open Space Plan, I move to approve and authorize the board chairperson and clerk register to sign the resolution adopting the 2021 Ottawa County Parks, Recreation, and Open Space Plan as the official planning document for Ottawa County Parks Commission and to recommend transmittal to the plan to the state of Michigan. Support.
Been moved and supported. Comments or questions?
Roger, Mr. Chairman.
Yes.
I'd like to comment if I could, with Jason and Kurt being here and this whole team put a lot of work into this, just a lot of work. I mean, I just commend them for the whole department, how they pull this thing together, the information that they have here and just a job well done. Yeah, thank you. Yes.
Mr. Chair?
Yes. Go ahead.
Yeah, is Parks there or no?
Yes. Yes.
Yes, okay. Just want to start off on page 46. The report talks about a gradual shift in the criteria of the MNTRF in recent years away from high quality natural resource projects toward more of an urban and low income focus. I wonder if we can kind of talk about that real quick, and then I got a couple other questions.
As you know, this is one of our primary grant programs, so we keep track very closely of what criteria they use to evaluate our projects. And they change every year. There's almost always a little change of some sort. But a few years ago, yeah, they did make a concerted effort to try to get some points available for more urban areas. So we can get some of those. It actually defines urbanized areas, and some areas of our county are in urbanized zones, and we get those points too, but a lot of our county is not, of course. So yeah, it's just more of an observation, and so we're just very cognizant of that when we put a grant application together for that program. It hasn't really slowed us down too much. We've been able to meet their criteria pretty well and have been successful.
Okay. And then it's a follow-up question. Do we have the same copy as you do? Is there only one copy or no?
The current copy is the one that's on the website. So if
Okay, I think on page 1, it talks about January 26, 2020.
Very good.
Definitely don't want to go through 2020 again.
Don't want to go through 2020.
And then on page 2, unless you guys know something, I don't. Paul Lilly is not a county commissioner.
Okay, that one I don't know, but I will definitely check that.
Yeah, check it out on page 2.
All right.
Anything else? Anybody else? If not, Justin, would you call the roll, please?
Yes, sir. Mr. Kyers,
Yes.
Mr. Holtvluwer,
Yes.
Mr. Meppelink,
Yes.
Mr. Terpstra,
Yes.
Mr. Garcia,
Yes.
Mr. Zylstra,
Yes.
Mr. Fensky. Is that a yes?
Yes.
Mr. Dannenberg,
Yes.
Mr. DeYoung,
Yes.
Mr. Bauman,
Yes.
and Mr. Bergman.
Yes.
The motion passes.
Okay.
Next will be a short-term lease for the West Michigan Agricultural Educational Center. And I move to approve and authorize the board chairperson and clerk register to sign the short-term lease for the West Michigan Agricultural Educational Center to extend the lease by 1 year to allow farming activity in the 2021 season.
Support.
And supported by several. So any comments or questions? Justin, would you call the roll, please?
Yes, sir. Mr. Fensky,
Yes.
Mr. Zylstra,
Yes.
Mr. Kyers,
Yes.
Mr. Garcia,
Yes.
Mr. Holtvluwer,
Yes.
Mr. Bauman,
Yes.
Mr. DeYoung,
Yes.
Mr. Meppelink,
Yes.
Mr. Dannenberg. Mr. Terpstra
Yes.
and Mr. Bergman.
Yes.
Motion passes.
Next is the item of Explorers Trail. I move to approve and authorize the board chairperson and clerk register to sign trail easements from Robert and Harriet Austin at 12222 60th Avenue at a cost of $2,000, and from Dale and Kathy Knoper at 11840 60th Avenue at a cost of $1,215.45.
Second.
There's moved and seconded. Comments or questions? Justin, would you call the roll, please?
Sir, Mr. Zylstra,
Yes.
Mr. Fensky, Mr. Baumann, Mr. Kyers,
Yes.
Mr. Garcia,
Yes.
Mr. Meppelink,
Yes.
Mr. Dannenberg, Mr. DeYoung,
Yes.
Mr. Holtvluwer,
Yes.
Mr. Terpstra,
Yes.
and Mr. Bergman.
Yes.
Motion passes.
From Finance and Administration, Mr. Baumann.
Thank you, Mr. Chairman. Regarding the Ottawa County Sewage Disposal Refunding Bond Series 2021, I make a motion to approve and authorize the board chairperson and clerk register to sign the resolution to authorize the issuance of not to exceed $465,000 Ottawa County Sewage Disposal Refunding Bond Series 2021, Chester Township System Number 1.
Support.
Been moved and supported. Comments or questions?
Yeah, Mr. Chair. I thought I saw Pat there. Is he online?
Yes, I am.
Yeah, I just wanted to thank Pat and Doug for walking me through this agenda item. And I'm really glad that, we can take this action for the benefit of Chester Township residents in this way. So I think it's really cool.
Great, thank you.
Pat, are you really at the stadium?
No, actually, I'm using my my engineer's tablet. I've got 3 computers going and 4 screens. Luckily, you guys impeccably timed the break of my other meeting, so
Perfect.
not at the
Okay,
stadium.
good. Thanks. All right. Any other comments or questions? Justin, would you call the roll, please?
Sir, Mr. Baumann,
Yes.
Mr. Garcia,
Yes.
Mr. Meppelink,
Yes.
Mr. Holtvluwer,
Yes.
Mr. DeYoung,
Yes.
Mr. Zylstra,
Yes.
Mr. Terpstra,
Yes.
Mr. Kyers,
Yes.
Mr. Dannenberg,
Yes.
Mr. Fensky,
Yes.
and Mr. Bergman. Motion passes.
Regarding the planning and performance improvement personnel request, I make a motion to approve the request to increase the project support specialist from a 0.48 full-time equivalent non-benefited to a 0.80 full-time equivalent benefited at a cost of $34,598.83.
Support. Been moved and supported. Comments or questions? Justin, will you call the roll, please?
Mr. Terpstra,
Yes.
Mr. Holtvluwer,
Yes.
Mr. Zylstra, Mr. Zylstra,
Yes.
Mr. Kyers,
Yes.
Mr. DeYoung,
Yes.
Mr. Meppelink,
Yes.
Mr. Baumann,
Yes.
Mr. Fensky,
Yes.
Mr. Dannenberg,
Yes.
Mr. Garcia,
Yes.
and Mr. Bergman. Mr. Bergman.
Yes.
Thank you. Motion passes.
Regarding the fiscal services personnel request, I make a motion to approve the addition of a public health financial manager as outlined at a total cost of $27,395.22.
Supported.
Been supported. Comments or questions? Justin, will you call the roll, please?
Yes, sir. Mr. Kyers,
Yes.
Mr. Holtvluwer,
Yes.
Mr. Garcia,
Yes.
Mr. Dannenberg, Mr. Dannenberg,
Yes.
Mr. DeYoung, Mr. DeYoung,
I'm sorry, yes.
Mr. Zylstra,
Yes.
Mr. Terpstra,
Yes.
Mr. Meppelink,
Yes.
Mr. Bauman,
Yes.
Mr. Fensky,
Yes.
and Mr. Bergman.
Yes.
Oh, that was a really good one. Thank you. Motion passes.
Regarding the Matrix Consulting Engineers proposal to provide lighting consulting services to upgrade the county's facilities to LED lighting, I make a motion to approve and authorize the board chairperson and clerk register to sign the contract with Matrix Consulting Engineers to provide lighting consulting services to upgrade the county's facilities to LED lighting in the amount of $77,500.
Support. Been moved and supported. Comments or questions? Yes, Randy.
Quick question. And maybe I didn't see it on, but do we have any numbers as far as to what that's going to save us as a county once we do this? Do we have, and maybe, like I said, I may have missed that through that in the packet, but I was just curious.
To give you some insight into that.
Commissioner, this is to hire a vendor to provide us with 2 or 3 options on how to convert our existing interior lighting to LED lighting. And so those options will include some cost estimates as well. And then once we select one of those options, we'll do a separate request for proposals for the actual construction work. So this is not construction work that we're proposing right now. This is to come up with 2 or 3 options as to the best way to convert to LED lighting that will provide the quickest return on our investment in terms of reduced energy costs, reduced maintenance, as well as maximizing the rebates that we would receive from the utility companies.
Okay, all right.
Anyone else? Justin, would you call a roll, please?
Yes. Mr. Garcia,
Yes.
Mr. Fensky,
Yes.
Mr. Zylstra,
Yes.
Mr. Dannenberg,
Yes.
Mr. Terpstra,
Yes.
Mr. Meppelink,
Yes.
Mr. Holfluer,
Yes.
Mr. Bauman, Mr. Kyers,
Yes.
Mr. DeYoung,
Yes.
and Mr. Bergman.
Yes.
Motion passes.
All right.
And finally, regarding the Highland District Courthouse locker room project, I make a motion to approve and authorize the chairperson and clerk register to sign the low bid from T2 Construction to construct men's and women's locker rooms at the Highland District Courthouse.
Support.
Been moved and supported. Comments or questions? Justin, would you call the roll, please?
Yes, sir. Mr. Dannenberg,
Yes.
Mr. Bauman,
Yes.
Mr. Fensky,
Yes.
Mr. Meppelink,
Yes.
Mr. Terpstra,
Yes.
Mr. Garcia,
Yes.
Mr. DeYoung,
Yes.
Mr. Holfluer,
Yes.
Mr. Zylstra,
No.
Mr. Kyers,
Yes.
and Mr. Bergman.
Yes.
Motion passes.
Appointments, none. Discussion items, none. Report by the county administrator.
Yes, I don't have a whole lot today. I'll just say that we are assisting Lisa with finding locations for vaccine rollout. And so if any of you have any ideas, in fact, I'll send out an email later and just try to get some ideas on how we can help her out with that. But that's it for today.
All right. And are you going to report on the COVID-19 administrative rules?
Well, I have them on here if there's any questions, and I did
Okay.
refer to them a
All
little
right.
earlier in the meeting.
Okay.
But yeah, it's basically, we have to ramp up an effort to get more staff to be able to set up distribution centers. And this one AR was for a position to coordinate that effort. And then the other is basically authorization of the quarantine payments basically for the sick time. So if there's a questions, we'd be happy to, either myself or Doug could answer those, but
All right, thank you. The next thing is general information, comments, or meetings attended. Should be an opportunity for commissioners to give any comments. Anyone like to speak at this time?
Mr. Chairman, if I can read an email that I received a couple of weeks ago. Am I able to do that?
Say again?
Am I able to read an email I received a couple of weeks ago?
Read it? Is that what you're saying?
Yes.
Okay, go ahead.
I know that the health department has been getting sort of a bum, reputation lately. So I received an email on January 13th from Mr. Amon, and it reads like this. Dear Mr. Garcia, yesterday I received my first COVID vaccine dose at the Grand Valley facility in Holland. I simply want to take a moment to tell you, while I was prepared for a long and frustrating process, I walked away feeling very impressed by the services from the health department. It was apparent that a lot of talented people planned well to prepare for this. Setting an appointment and preloading my information was clear and easy. The line when I arrived was only about a 20-minute wait. The staff was courteous, positive, and efficient. Those getting their shots were masked and maintained a good social distance. I appreciate the information that was made available and the opportunity to make an appointment for the booster dose in 20 days. I cannot think of one thing that would have improved the process. Well done. Please pass along those in charge that their efforts were noted and much appreciated. When I saw what is happening in other parts of the country, both in the spread of the virus and the implementation of the vaccine, I feel fortunate to be a West Michigan native and a resident of Ottawa County. Again, thank you for a job well done. And that's from a Mr. Martin Amon, 2065 Chapel Lane, Holland, Michigan.
Thank you, Frank. Anyone else? Yes, Mr. Holtfloor?
Hi, I just want to thank Greg for doing the prayer for me. My computer shut off. This is how I was supposed to do that. So it was perfect. Thank you, Greg.
Yep, thanks.
Mr. Chair,
Yes.
following up a little bit what Frank says in regards to the health department. We have an incredible health department here too, just like our parks department. And these folks are working night and day and getting hammered with a lot of different things. I want to encourage this board to just sometime the next day or so, maybe even today, to send a little message of encouragement to Lisa. Don't leave it up to somebody else. Don't let somebody else say somebody else is going to do it. I think it would be just a huge blessing for her if she heard from 11 of us just thanking her sincerely and her department for the work that they're doing.
Yeah, yeah, okay, thank you.
Hey, Chair.
Yes.
Me and Matt we attended the MSU extension meeting. And I just would like to encourage everybody, all the different commissioners, to like their Facebook page, the district, what is it, 7, Matt?
I think so. Mhm.
On their Facebook page, there's a plethora of stuff that the extension, MSU extension can do for all of the Ottawa County residents. It's just not for farming. I mean, there is just so much different things that they cover that I think that you guys should share with your guys' constituents.
Thanks, Kyle. And I just wanted to congratulate Robin, Juanita, and Raina for their recognition by MPWRD Business Magazine. And Robin is one of the top 10, and maybe you could, Al, do you know about that? You probably know about that award that she won, or that recognition that they have.
Well, I don't know a whole lot about that, except to say that I know, in fact, there should be a digest article this week. I've asked Robin to put something together for us.
Okay.
But it's just, I mean, she's being recognized all over for the great
Yes.
work that she's doing with DEI. Of course, Raina's received a lot of recognition over the years as well, as has a judge. So we just have phenomenal people working for us, and we will make sure that we get some details out on that.
Okay, good. Thank you. The next thing on the agenda is public comment. This is the second time in our meeting. We can take public comment from anyone here or on Zoom. Is there anyone on Zoom that would like to speak with us at this time?
Not right now, Mr. Chair.
Okay. If not, I will ask for a motion to adjourn.
So moved. Support.
All in favor, say aye.
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 Aye. We're adjourned. Thank you, gentlemen, ladies.
Thank you, Mr. Chair.